This is a Hope 1032 podcast.
To She Wasn't Born Yesterday for women who are 40 plus fabulous by the Empty Nest Chicks. I'm Janet Evans, ex-M&T Saatchi advertising creative who have won numerous radio and TV awards. Not that that'll affect us because we're doing a podcast.
And I'm Dr. Amelia Haynes, who has been a medical doctor for 30 years and specialising in sexual health and mental health and relationships, and I'm generally a very useful human being.
Well, we'll find out about that, but we are here to work together.
People tell me on good authority that I am.
Really? Yes, well, they never say that to me, so I think we're the perfect hosts for She Wasn't Born Yesterday. Dr. Amelia, more women go through breast cancer than any other kind. But what should we be doing if we're high risk? That's what we're going to talk about today.
Okay.
And the most common cancer in women 40 plus fabulous is breast cancer. And cancer's still a word that really just sends chills
Freaks
down
people out a lot.
It does. And I feel like in some ways we've come a long way in terms of detection, in terms of treatments and all that sort of thing. So, but I do wonder, is vigilance still the best way to avoid it? Actually, I work in advertising, as you know.
Yeah.
There was a really interesting campaign in India that Lux Soap did because they discovered that Indian women were sort of a bit shy about checking themselves for signs of breast cancer, and sort of touching their breasts made them feel uncomfortable.
Yes.
And so Lux actually thought of a way to encourage self-examination and just sort of incidentally boost sales.
Boost sales of
Lux Soap.
Yeah.
But they invented Lux Soap with a lump. And so what it did was it had a little tiny raised lump bit on the actual soap, which just gave women an idea of what they might be feeling if they have a sign of breast cancer. And apparently it was hugely successful. It was a very clever idea, because it reached 9.4 million women in 24 hours. And the Indian Cancer Society said there was a 30% increase in inquiries about breast cancer and early detection immediately after the launch.
Okay.
And while we don't have anything like that here in Australia, we do have Dr. Patsy Soon, who is a breast surgeon at Bankstown Hospital and is the clinical director of BreastScreen Southwestern Sydney. Welcome to the podcast, Dr. Patsy.
Thank you for having me.
Awesome.
Our pleasure. Super nice to see you.
Dr. Patsy, I've heard that the risk of breast cancer increases with age. So why is that particularly?
So there are a few risk factors for breast cancer. The two main ones is increasing age and being female.
Yes. But so why age? Like what difference does age make? Because you do hear about very young women obviously getting breast cancer as well.
Yes, but it's not common. So the incidence actually rises steadily from age 25 to 29 and then more steeply from 35 to 39. And it's highest in the older age group. So in the UK, when they looked at it in 2016 to 2018, each year roughly a quarter of the new cases were in women aged 75 and over.
Oh, wow.
It could be as we get older with the cells growing each time, there can be more mutations within the DNA of the cells, and then that predisposes to cancer formation.
Yeah, wow.
More likely that your body's going to not replicate the right way.
How dare it not? But breast cancer seems to be especially nasty in that you hear lots of stories about people who, like Olivia Newton-John, for example, who seem to have defeated it while they're young, and then it pops up and returns like many years later. She had it over a period of 30 years. Yeah. And so why is it that it comes back so much later?
There are different types of breast cancer.
Yeah.
The commonest type of breast cancer is the ER, PR positive and HER2 negative one.
Yep.
And that is generally less aggressive, which is good. But the downside is that the woman is never really cured of it because it can come back, as you pointed out, many, many years later. So why is this? Well, it is thought that, at the time that the cancer is diagnosed, many of them will have little cancer cells already floating around in the blood in the body.
Yeah.
And these tiny cancer cells survive in a state of what's called tumor dormancy. So these cells are very quiet. They can grow, but then it's balanced by death. So cell growth and cell death are in balance. So the tumor doesn't really grow. It's just dormant. But then at a later stage, and we don't fully understand why this happens, these tiny cancer cells that are floating around begin to grow again and stop being dormant. And that's when it actually does grow and form a cancer somewhere else, like in the bones or the liver or lungs.
Potentially some of the other cancers are more aggressive, but they don't hang around in your system. Is that what you're saying?
The more aggressive sort, which are called triple negative breast cancer, which is ER/PR HER2 negative, or the HER2 positive ones, those ones are more aggressive, but they do respond better to treatment such as chemotherapy. And so they tend to come back. If they do come back, they will come back within the first 5 years. Yeah.
And so is there a particular type of woman, 40 plus fabulous, who is at higher risk than other women?
Well, there are, if the woman has a known genetic mutation, say in the BRCA1 or BRCA2 gene, that definitely puts up their risk of breast cancer, usually in the order of 30 to 60%, a lifetime risk.
Yep.
And there are others with a strong family history of breast cancer, particularly those with a first-degree relative, that is a mother or a sister or a daughter with breast cancer under the age of 50. So their risk is higher. A woman who previously have had a breast biopsy and then shown to have an atypical result. So that puts up their risk. Also, more recently, we know that having dense breasts, so that means that when the lady has a mammogram, it looks very white, the mammogram. That means that they have more breast glandular tissue instead of fatty tissue. And we know that that itself is an independent risk factor for breast cancer. Yeah.
And so how does it happen? So say you find a lump on your breast in the shower with your soap, which may or may not be Lux. You would presumably then go to your GP, and then what would happen then typically for a woman?
So the GP would typically examine, get a history from her about the lump, how long it's been, about her family history, about her previous history, and then the GP would examine her and then send her for a mammogram and ultrasound. And if, it shows up something, then she will likely have a biopsy of the lump. Yep. Obviously, if the result comes back cancer, she will usually be referred on to a breast surgeon. Yep.
See
someone like you.
Very, very quickly.
Yes,
actually, that's the other thing. Like, they won't forget to ring you. If the biopsy shows something worrying, you'll be getting a phone call from someone who will talk to you very, very quickly and get you in to see someone like Patsy.
Yeah. And so you only, of course, ever see people who have cancer, and it may or may not be in the early stages or later stages. So what's your procedure then? Do you sit down and have a meeting with them, and what do you do when people come to see you?
So I have a clinic in the hospital. Yep. So when the patient comes, usually I know that it's a patient with breast cancer because the GP has very kindly sent me all that information beforehand. I usually will try to get a breast care nurse in with me. Yep. So we do have 2 breast care nurses in the hospital. And so I will do the same thing again, like what the GP has done. So take a history from the patient, examine the patient, and then I will look at the imaging, the mammogram and ultrasound with her. And then I will go over the results with her. And then I will give her an outline, explain to her what treatment entails. Some patients I will send off for further tests.
Okay.
And depending on that, then book them in for an operation or refer them on to have chemotherapy first.
Oh, okay. So you might not operate every time. Why would they get chemotherapy first before they come back to you?
Some patients I know will need chemotherapy. So like we were talking about the more aggressive cancer, like the triple negative breast cancer or the HER2 positive, those patients will need chemotherapy. And if I know that they will need chemotherapy, having chemotherapy before operation definitely has advantages because it will show us how that particular woman's cancer will respond to the chemotherapy. Because after chemotherapy, the woman will have an operation to remove the area or remove the whole breast, depending. Then that specimen is examined by the pathologist underneath the microscope to give us a report. If there's no cancer cells left behind, that's a very good result. We call that a complete pathological response. But if there's still some cancer cells left behind, then what we can do is tailor the treatment, the subsequent treatment for that woman. We could change the drugs that she's going to have, something to help improve her outcome.
I guess depending on the procedure, you would take them into surgery, book them in, and either just remove the lump or perhaps do a mastectomy. Is that right?
It's very bespoke, isn't it, Patsy? Like each woman is quite particular. That's why they need to talk to Patsy about what their options are, and sometimes they, depending on the woman, like say, I really, really don't want you to take the breast, or actually I'd feel better if you took everything. Yeah.
Yeah,
exactly. So I have to mention as well that when we treat breast cancer, we treat a woman with breast cancer, we do it in a multidisciplinary team.
Yeah.
So we do actually, so when I see a woman, I will bring her case to our multidisciplinary team meeting. Okay. Where, as a surgeon, I attend that, but the medical oncologist, so the chemotherapy tablet doctor, the radiation oncologist, the radiotherapy doctor, the radiologist, the X-ray doctor who looks at all the images, the pathologist, the breast care nurse, we all attend the meeting and we actually discuss the case. And as Dr. Amelia says, it's bespoke. We tailor the treatment to that particular woman. And at the end of the meeting, I go back and talk to the woman. And obviously what the woman wants is taken into account as well.
Yeah.
Obviously.
It's very good information. In Australia, people should feel so reassured by what Patsy's just said.
That's just awesome.
It's just so many good minds and good research on your particular case.
Yeah. And, I mean, it must be immensely shocking and distressing for women, particularly if it's just completely out of the blue. And can they get counselling with your services as well? Is that part of the team?
Definitely. So that's why the breast care nurse is a great, support person. She will usually touch base with the woman after. Because as you say, it can be a big shock to them.
Yes.
Obviously, different people respond differently.
Yeah.
But we do have a clinical psychologist in the cancer center, and we can refer to her, and she can, see the woman and talk her through management of these feelings. Yeah.
I was interested, in 2013, which is over 10 years ago, Angelina Jolie, she found out that she had that BRCA1 gene and a strong family history. And so she did a preventative double mastectomy and also had her ovaries removed and fallopian tubes as well. Should we all be madly getting tested for this gene? And if we have it, should we be doing what Angelina did, do you think?
So first of all, this gene only makes up 5 to 10% of breast cancer cases.
Right.
So 90 to 95% of women with breast cancer don't have a gene that they inherit.
Right. Okay.
It's just because breast cancer is so common in Australia. 1 in 7 women have it. So it's a very common cancer. And it could just be, because it's so common, you have an auntie or your grandmother had it when she was 90 or whatever.
Yeah.
It's just because it's so common. But having something that runs in the family like Angelina, only 5 to 10% of women have it. So it's not very common at all. In Australia, if we see a patient with breast cancer and we think that she might have, because of a family history or her type of cancer, she might possibly have a gene mutation, we will refer them off for genetic testing.
Okay. But, I think actually a lot of women at the time reacted to that and went off and had double mastectomies themselves. And it just sounded like so drastic.
Well, I don't know between America and Australia, I think are very different countries. So in Australia, I'm sure a lot of people did get worried, but in Australia that have had strong counselling from all sorts of different doctors actually about whether or not they should even bother to have their genetic profile checked. So I'm sure Patsy did see a few people who kind of slipped in there and kind of went, no, I really, really want to know. But it's really only at that point when people have the mutation that they would even be offered anything in Australia. You can't just walk in to Patsy and say, take them out.
Take them off. Chop them off.
Yeah.
Just in case.
Exactly. We wouldn't do that. No.
Is that right?
You'd
Really?
have
So
to
if
have
someone
a reason.
Right. So even if someone just came into you and said, I'm really scared. I'm scared to death. I don't want to have the testing, but I'm really scared. I just want to have them off. You wouldn't respond to that.
No, it's, obviously you talk to the woman, explore her fears, refer her on to a to a clinical psychologist if necessary.
Yeah.
But you wouldn't just do it just straight away. No.
Yeah, right.
There might have been a few who slipped through the net in America.
Yeah, that's right. Can men get breast cancer?
Indeed.
Yes, they can.
Yes.
So women is 1 in 7 in Australia. Men is 1 in 500. So yes, they can get breast cancer because they've got breast tissue as well. Not as much as women, obviously, but they do have breast tissue. Yeah.
That's interesting because there's absolutely
breast glandular tissue.
Yeah. There's no information aimed at men about testing their breasts.
That's because it's so, the number is so small compared to
1 in 500.
Exactly.
That sounds a lot to me.
But compared to 1 in 7.
Yeah, compared
1 in
to
500.
1 in 500 still sounds like a lot. I mean,
I think men just need to know that it's possible.
Yeah. Have you ever treated a guy with breast cancer?
Yeah, I've treated 3 men. Yeah.
Wow.
There you go.
Okay.
I certainly haven't.
How old were they?
They were older. They were in 50s, 60s, 70s. Yeah.
Wow. And I wonder how they found out.
Usually they present with a lump.
Yeah, right. What do you recommend is the most practical way that women 40 plus can monitor your breast health?
So they should have a feel or check their breasts every month just to look for any lumps or look in the mirror to see if there are any skin changes like dimplings, the nipple pulling in. So once a month. And then have mammograms every 2 years. So BreastScreen will actively invite women age 50 to 74 with a letter every 2 years. But women from the age of 40, between 40 and 50, if they ring BreastScreen, they can have a mammogram every 2 years as well.
Yeah, right.
And over 70, obviously, over 74, obviously, women can have mammograms as well. They just need to ring. They won't get an invitation letter.
Oh, why are they excluding, women who are 70 plus fabulous?
Yeah, exactly.
I was going to say they're not excluding,
Right.
they're just not reminding because they might have competing health issues, I guess.
Okay, because 70 is the new 30, so I mean, they really should be included. What are the prospects if you find a breast lump early? you go and get it checked early and perhaps surgery early and chemo and all of that sort of thing. What are your prospects these days?
Excellent.
Yes,
Very
I was going to say
excellent in
pretty
Australia.
jolly good.
Right,
Yeah.
right. So we're talking...
Overall, 5-year survival for breast cancer in women, so the number of women who will live up to 5 years is 92%.
Yeah.
And I think 86% up to 10 years. So overall, it's excellent. And if the cancer is small and just in the breast, so stage 1, 100% of women will live 5 years.
Wow.
You know, I think breast cancer basically has just got some very bad press because, you know, it's very scary. So that's quite appropriate that we do go, okay, like it's important that we realise it does occur and it occurs ever so much more as we get older. But it's got very bad press. I know that I'm sure that Patsy knows this too, that other doctors who treat other kind of cancers go, well, look, breast cancer gets all the funding.
Yeah.
It gets all the fundraising.
Yeah.
Like the rest of us would like some fundraising too. Yeah. So breast cancer has just managed to, I think, ignite everyone's kind of terror. And, you know, that's one of the reasons why you yourself are kind of going, what's going on with breast cancer?
Exactly, yeah. Well, I mean, you know, it does go to sort of the heart of womanhood, really, doesn't it? I mean, if you've had kids and all that sort of thing, you know, it's very much close to home. And
actually, my feeling is women probably really do vary on that one. I personally would be one of the people who would knock on Patsy's door and say, look, I don't have the BRCA gene, but actually, can you remove them, please? I don't need them.
Yeah.
So I'm very much that kind of person who just take them away. I don't want to go through the kind of even thinking about having mammograms, and I don't want to change genders or anything, but just honestly take them away. But it sounds like maybe you're fonder of yours than I am of mine.
Oh, look, I can't do without them.
Oh,
they're my girls.
Go.
You know, they're my girls.
There we go. So I think we all have a very different relationship with them.
So, yeah, it's funny. It must be because a lot of celebrities had wives with breast cancer or celebrities had breast cancer themselves that there's been so much money and pink ribbons and so much attention focused on it. But, I mean, it's a good thing, right?
Yes, because of all that fundraising, all that money that funds research. And that's why we have like 100% breast cancer survival for 5 years in early stage. And also breast screening definitely improves the outcome for women. Yeah.
And so women who have a mastectomy, can they get a sort of reconstruction? Do you do that part of breast surgery or is that a different...
No. Reconstruction can happen immediately, so at the time of the mastectomy, or delayed later on.
Okay.
And it could be reconstruction using an implant, or it could be using your own tummy tissue. Okay. And that the one using your own tummy tissue is usually done by the plastic surgeons because it requires microsurgery.
Okay. So would that happen as part of your multidisciplinary team, or is that a separate area?
So that's in the preoperative phase. Yeah, we do, if the patient, needs a mastectomy and she wants to have a reconstruction using a tummy tissue, we do refer on to the plastic surgeons.
Yeah, wow. Yeah. We're so lucky in this country, aren't we?
We are. We are.
Do you ever find your job distressing gorgeous? Are there any cases where you think, I really need to detox from this day? And how do you do that?
I must admit, I enjoy my work simply because breast cancer, usually the outcome is good.
Yeah.
And even for women, so the ones that I treat, operate on, I see them years later. So I first started in 2008.
Awesome.
And I still see the patients coming back to see me every year. And I like catching up with them.
Yeah.
But even for women who have stage 4 disease, that is cancer that has gone elsewhere.
Yeah.
There's still, quite good treatment. So usually in the past, it was, the cancer has spread elsewhere. People will think, oh, I've got like 6 months, but that's not the case. Yeah. Not always the case. Some people, 32% of them survive for 5 years. Yeah. So treatment is definitely changing all the time and improving.
Yeah.
So, and that's what I like about breast cancer. Yeah. The outcome is generally good.
Yeah. So when you say 5 years, do you mean a minimum of 5 years or a maximum?
Up to 5 years.
Up to 5 years.
Well, like how many of them are still around at 5 years?
At 5
you know
years,
what I mean?
Because to me that doesn't sound like a lot. Like
What?
5 years. If I only had 5 more years to live.
No, but it's a huge percentage.
Right.
It's 92%.
Yes.
Are still around at 5 years.
Yes.
Which means only 8% of them have gone, and like it's gone really badly and they've died. Do you see what I mean?
Right. But then what about after the 5 years?
Well, Patsy would have the statistics. They're around, and maybe it's going to be fantastic. Listen.
So they say 86% around at 10 years.
10 years? What about 20?
86.
Yeah.
20?
So I don't have the figures for 20. Sorry.
And Patsy, it reminds me of when I was a medical student and the doctors would say, like the surgeons would say, but look, you might get hit by a bus.
Yeah.
And if you get hit by a bus, that's a cure, man.
Oh, that's dark. That's dark humour, man. Typical medical people.
Yeah.
You know. Well, Dr. Patsy, we hope we never meet you professionally, but it has been a delight talking to you personally. And we really appreciate your advice and your insights on this and the positive, hopeful outlook for women if they do discover a lump. And we absolutely urge all women to examine their breasts regularly, as you say.
Every 2 years for our particular podcast. Listeners.
Well,
yes.
Well, that's the mammograms, right?
Or the mammograms, and the ultrasound. Examining every month.
Yes. And
which is a harder ask, I have to say. Personally, even though it's a scary thing, are you good? I personally am not.
What? About doing it?
Yes.
Oh, yeah. No, because I've got a family history. So I definitely am good. I'm all over it.
Good on you.
You should do it in the shower, like with the soap on.
No.
Yeah.
Yes.
I know.
I'm going to send you some.
You can actually feel smaller lumps when you have the soap on.
I know. I'm just an absolute slacker when it comes to me.
Typical doctor. You know what I mean?
I'm very paranoid about other things. That's why I'd have them lopped off so I could be lazy.
That is not a solution. Just don't do what Angie did. Dr. Patsy, thank you so much for being on She Wasn't Born Yesterday.
Thank you.
Thank you.
Gorge, thanks for listening in today. We hope you enjoyed this ep.
But we'd really love to hear more from you. We'd love to know exactly what you actually think of us and our guests.
So if you're on Spotify, you can rate us. We love stars. And on Apple Pods, write us a little blurb. Let us know what you think and hopefully we can keep going. Apple loves their algorithms and we love you. So thanks for listening. We really enjoy your company.
See you next week on She Wasn't Born Yesterday.
Hope 1032. Thanks for listening.